Hello, welcome to the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Maryanne Matthews and I'm here with Dr. Stewart Kennedy, our COVID-19 Incident Manager. So, welcome back, Dr. Kennedy. The people didn't see you for a few weeks. They must have missed you terribly. How are you?
Well, I've had a great 2 weeks, but I'm ready to get rocking and rolling here.
I guess. So, well-deserved time off, and everyone's happy to have you back. So let's just get started. On Monday, the COVID-19 Assessment Center at our hospital took on a larger role in the community's pandemic response. Can you tell us a little bit more about that?
Yeah, thanks, Maryanne. I mean, we have a great city team here. We're such well coordinated, and we work really well with our partners. And I guess I'd like to thank, first off, the Thunder Bay Health Unit for taking on this role. It's been new for all of us, but they have other things to do. They need to sort of do their contact tracing, get the schools ready, get the restaurants ready, so they have a lot of work to do. So we gladly had a good communications with the health centers, health unit, and that sort of task have now transferred to us at Thunder Regional Hospital. And certainly it was the volume initially was quite high, unexpectedly high over the weekend, but I think as just informed today that we've caught up with the volume at the assessment center. So, but there still will be some hiccups, so just please be patient with us. But we still encourage everybody to make sure you call if you require a COVID test appointment. They're still being performed in the trailer outside the emergency department, but we will be transitioning to a new place just on the parking lot in a permanent site as we move forward. But make sure the number is 807-935-8100 for people who require testing, and as long as we follow the proper protocols. Certainly, and it's important that we do have appointments. No walk-ins are still allowed because that has a potential sort of exposure to COVID-19 with people in waiting lines. So all in all, good. We're ready to take on this task, and certainly I think we have a great supportive staff working long hours to make this as seamless as possible.
Absolutely. So it seems like we had a lot of calls at the beginning, and now, like you said, we're all caught up. And so the only real thing that's changed for community members is just the number that they're calling. So they're calling us instead of the health unit to book their test, but they're still coming here to do the test, and they're still being scheduled in this relatively the same manner, correct?
Correct.
Okay.
Yes.
Great. So with more care partners coming through our hospital, in addition to all the testing that we're doing through the assessment center, another important component of preventing spread of COVID-19 is physical distancing. So now that we have more volumes and patients coming through, care partners being back in, is it a challenge to ensure physical distancing here at the hospital?
Absolutely, and it's a challenge all over the world, all over Ontario, all over the city of Thunder Bay, and no solution wherever you're dealing with is going to be perfect. So that is why we continue to encourage mandated masks to be worn in this hospital and in any place in the public, especially inside where you cannot maintain that 2-meter distance. Our hospital is not designed to ensure that 2-meter distance. Almost impossible to take a building that was sort of built about 15, 16 years ago, not expecting a sort of global pandemic in their sort of design, but we have a large staff working really hard to actually design the space to ensure as best they can that 2-meter distance. And I think they've done a remarkable job, but certainly we're obligated as patients, as staff, to try on your own sort of personal initiative to maintain that 2-meter distance also when you can. And when you cannot, and that's why the mandatory masks are in place to make sure you are not spreading COVID-19. I mean, the good news in Thunder Bay, and there's still good news in Thunder Bay, we only have 3 active cases, and we've done a remarkable job as citizens to prevent any spread in the community. We expect more cases to continue to trickle in, and I'm hoping it will be a trickle and not an explosion. But as long as we continue to keep our distance and keep on the public health guidelines of washing your hands, keeping that 2-meter distance, we still continue to do well here in Thunder Bay. There is a concern, you know, in the fall time with flu season coming, and the cold weather coming, that there's more people in closer indoor environments, that the potential spread will increase. But we're doing our best here at our hospital to put safety measures in place to maintain that 2-meter distance. But I'm just going to tell the public right now, it's going to be impossible to do that 100% of the time.
Yeah, absolutely. And like we've kind of learned throughout this whole experience is as things change, as new information comes in, we adapt. So we'll constantly be looking at new solutions as situations change, and we just need everyone's cooperation as we do that.
Yes.
So speaking of how well our community's done, and we only have 3 active cases, what's the situation at our hospital in terms of COVID-19 positive patients?
So we have no admitted patient with COVID-19. Our hospital capacity is hovering around 90%. We are discussing in our recovery phase of our IMS structure today regarding stepping up our elective program again, depending on what resources we're going to require, and that recommendation is going to come to IMS today. But, you know, we have to be ready for normal business. I'll give you an example. I mean, as we all know, Red Lake is being evacuated. We need to make sure we have capacity here at our hospital to take the sick from the Red Lake Hospital if they need sort of a tertiary care center like Thunder Regional Hospital. And we have taken on a number of patients from Red Lake, and the whole northwestern region has really responded to the Red Lake disaster. So despite COVID-19, healthcare needs continue, and we want to make sure that we're positioned to make sure we take care of all the healthcare needs, both in Thunder Bay and the region.
Okay, great. Well, it sounds like it's a good thing you had your 2 weeks because there's still a lot of work to go, so you're nice and rested, ready to take on all the new challenges as they come.
You bet.
Okay, great. Thank you so much, and thank you everybody for watching.
Thanks, Maryanne.